Hello everyone. We're excited to present another engaging educational video as part of the nursing curriculum. However, I hope you're not only enjoying our entertaining lectures, but also using them to upskill yourself, as we are eager to bring you more educational content in our upcoming videos. Let's begin by introducing today's topic. Today, our interactive session is about systematic racism in clinical setting, through which we will discuss the effects of racism on clinical care by examining coroner's inquest reports. So, get ready to think critically as we dive deep into this issue, and remember, although you're not answering out loud, please ponder the questions I ask throughout the video. Let's get started. First off, let's get to know what exactly coroner's inquest reports really are. A coroner inquest report is an official document that details the findings of an investigation into the circumstances surrounding a person's death. It helps to identify any problems that may have contributed to the death, and to help prevent similar deaths from occurring in the future. So, when someone dies unexpectedly, the coroner may be called to investigate the cause of death, and the legal process begins that involves gathering evidence and hearing testimony from witnesses to determine how the person died. They write a report summarizing their findings, circumstances, and contributing factors that may have played a role in their death. So, ultimately, this essential document helps us understand the underlying issues, like indirect racism, that might have affected the quality of care provided in a clinical setting. Now, let's connect this document of coroner inquest with racism and clinical care, and see how you can subtly identify the problems in this report. Racism can manifest in various ways, from overt acts of discrimination to subtle, indirect behaviors. These overacts include unequal treatment, cultural misunderstandings, implicit biases, and negligence of doctors and healthcare workers. Now imagine how these issues might be reflected in a coroner's inquest report. To address these problems, let's now identify evidence-based nursing practices and analyze a coroner's inquest report. 1. To find evidence-based nursing practices, we can conduct secondary research using databases like PubMed, CINAHL, and Medline, as they contain a wealth of information on studies and interventions that can help combat racism and improve patient care in clinical settings. 2. Examine a coroner's inquest report, considering racism's potential role. Look for indications of cultural misunderstandings, implicit biases, or unequal treatment in the interaction between healthcare providers and patients. Also, look for any signs of systematic racism. 3. Reflect on the nursing practices you've researched and implement them to improve patient care and reduce racism's impact. After reviewing the coroner's inquest report, let's discuss how healthcare providers address systemic racism and students can contribute. So, what are some strategies that can be implemented to ensure equal and high-quality care for all patients, regardless of their race or ethnicity? That's right. Some of these strategies that healthcare providers can implement are cultural competency training, implicit bias workshops, and diversity promotion within teams and leadership. These strategies can help reduce the impact of implicit biases on healthcare decisions and foster an inclusive environment where every patient receives high-quality care. Students can also contribute by advocating for diversity and cultural competence in their curriculum and seek out opportunities to work within diverse patient populations. It's essential to be aware of the adverse impacts of racism on clinical care and understand how to identify these issues through tools like the coroner's inquest. By doing so, we can work together to create a more inclusive and equitable healthcare system. So, what are your thoughts on the topic? Share your opinions and experiences in the comments section below. And if you found this video helpful, remember to like, share, and subscribe for more insightful content. Thanks for watching, and see you in the next video.